Hey, welcome back. Let's take a look at some musculoskeletal ultrasound imaging. This is a long axis as well as a short axis view of the supraspinatus tendon. This is a short video of the supraspinatus tendon. This is a long axis view using ultrasound imaging. Now we have some still shots that we can analyze. So notice the patient position. So she is in this let me check or hand in your back pocket position. That exposes a good portion of the supraspinatus tendon for imaging. Also note the transducer orientation. It is aligned parallel with the fibers of the supraspinatus, which is the long axis view. And just to get oriented, the left side is going to be the more proximal side. Now, when we're doing musculoskeletal ultrasound imaging, it's, I think, good practice to identify the cortical line first. Anything deep to the cortical line is going to be artifact. Greater tubercle is there. That's going to be the attachment point of the supraspinatus. And hopefully you can see or appreciate the hyperechoic tendon attaching near that greater tubercle area. This is the anechoic line of articular cartilage on the humeral head. Articular cartilage is high in water content, so it tends to appear anechoic in ultrasound imaging. Now we can look more specifically at the supraspinatus tendon. So it should be this, as in this image, this continuous hyperechoic, brighter white signal intensity. If you look to the left more proximally, that's the musculotendinous junction, that convergence of muscle into tendinous tissue. And then you can see the deltoid muscle there superficial to the supraspinatus tendon. Now let's take a short axis view of the supraspinatus tendon. Notice that the orientation of the transducer has changed. We are now perpendicular to the fibers of the supraspinatus tendon. Again, musculoskeletal imaging, we want to identify the cortical line first. So you can see the humeral cortex is labeled. Just superficial to the cortical line, you'll see the anechoic articular cartilage. There you can see the supraspinatus tendon. Again, the fibers should appear hyperechoic and consistent throughout. That would be considered a normal imaging finding. And then superficial to the supraspinatus, you'll see the more hypoechoic deltoid muscle. Thanks for watching. Please consider giving this video a like and also subscribe to our OrthoNugs channel. Here are some other playlists that you're going to want to check out from the OrthoNugs library. Thanks again.